As 2026 gets closer, anyone on Medicare or thinking about signing up needs to understand that the program still leaves out some really big areas of healthcare. These gaps can cost thousands of dollars a year, and if you're living on a fixed income, they can create serious financial stress. In this video, we'll talk about the 5 biggest services Medicare still won't pay for in 2026, and I'll also share a few quick updates that could save you money next year. Let's start with vision. Medicare still doesn't cover routine eye exams, glasses, or contact lenses. The only exception is one pair of glasses or contacts if you've just had cataract surgery. So if you need a yearly eye checkup or a new prescription for glasses, you're on your own. A simple exam can cost $100 to $250, and a good pair of glasses or progressive lenses can run several hundred more. Some Medicare Advantage plans include small vision benefits, but they rarely cover everything. If keeping your eyesight sharp is important, you'll need either a separate vision insurance plan or an Advantage plan with better coverage. Hearing care is another major gap. Original Medicare doesn't cover hearing aids or the exams you need to get fitted for them. Diagnostic tests ordered by your doctor are covered, but the devices themselves and the fitting process are your responsibility. Traditional hearing aids often cost between $2,000 and $6,000 per pair, and they usually need to be replaced every 5 to 7 years. Over-the-counter models are cheaper, often around $800 to $1,000, but Medicare still doesn't pay for them. Some Advantage plans will help a little, but benefits vary a lot, so read the fine print before you assume you're protected. Routine services like cleanings, fillings, dentures, implants, and root canals are not part of original Medicare. The only time Medicare helps is if the dental work is medically necessary for another procedure, like before a heart valve replacement or organ transplant. Otherwise, you'll need to budget for it yourself. Cleanings can run $100 or more, fillings $150 and up, and a single implant can cost several $1,000s. Some Advantage plans advertise dental coverage, but most put a cap on how much they'll pay, usually $1,000 to $1,500 per year, and that doesn't go far if you need crowns or implants. One of the biggest surprises for many retirees is that Medicare does not cover long-term custodial care. If you need help with bathing, dressing, eating, or if you move into a nursing home or assisted living because you can't live on your own, Medicare won't pick up the tab. What it does cover is short-term skilled nursing care after a hospital stay, and even that is limited to 100 days if you meet all the requirements. After that, you pay the full amount yourself. The average cost of a nursing home can be $100,000 a year, and assisted living can be half that or more. To protect yourself, you may want to look into long-term care insurance or hybrid life insurance policies that include long-term care benefits, and the earlier you buy them, the cheaper the premiums. Finally, let's clear up confusion about annual physicals. Many people expect a full head-to-toe checkup each year, complete with blood tests and screenings. Medicare doesn't actually cover that. What you get is a one-time welcome to Medicare visit and yearly wellness visits after that. These focus on preventive care, updating your medical history, checking vitals, and talking about risk factors. They don't include routine blood work or a full physical exam unless there's a medical reason for those services. When you make your appointment, be sure to ask for your annual wellness visit if you want to avoid surprise bills. Before we wrap up, here are some important 2026 updates that could help you save money. Medicare Part D will keep a $2,100 annual cap on out-of-pocket prescription costs, and you'll still have the option to spread those costs out over the year instead of paying everything at once. All recommended adult vaccines, like shingles, flu, and pneumonia, remain free, and the $35 monthly insulin cap is staying in place, which is a big help for people managing diabetes. There's also a tiny expansion in dental coverage for very specific medical needs, like organ transplants or heart valve surgery, but routine cleanings and dentures are still excluded, so now it's your turn. Which of these uncovered costs in 2026 worries you most? Is it vision, dental, long-term care, or something else? Share your thoughts in the comments because your experiences can really help others watching this video. And if you found this information useful, please give it a thumbs up so more people can see it, and subscribe for more updates on Medicare, Social Security, and other financial tips that matter most to you.